We continue our series for the children, and joining us today to discuss the importance of poison safety is Dr. Michael Ramsey. Dr. Ramsey, welcome to our show today.
Thank you for having me. Very good, thank you.
All right, so we're talking about poison safety, and I guess that could be a number of things.
Right. You know, there was a very high-profile case here in the Wiregrass very recently where a mother had mixed some of her own medication in with a drink and had left it available, and the toddler in the house drank it and ended up having to be life-flighted to Birmingham. So poisoning is something that can be very serious very quickly in young children.
Yes, that's not good. Tell us, I guess medicine right off is one thing we think of with poison.
Right.
Could you kind of give us cleaning supplies is another thing that comes to mind. Maybe some other things to look out for?
Sure. Medications is something that a lot of people don't think about, especially if you're not on any medicines yourself, but sometimes children will go to different places where medicines are available, like a grandparent's house, or a grandparent can come to visit and have medication in their purse. And so it's important to have those in child-proof containers. Also, if you do take a lot of medicines yourself, or you have different people in your house who have different medicines, keeping children's medicines separated from adult medicines would be important, just so that you don't accidentally give a child the wrong medication intending something else. Something that seems kind of intuitive is when you're giving a child medication, don't do it in the dark. You know, a lot of times kids will get sick at night. They'll have a fever, you'll pull out a Tylenol bottle, and it's very easy to misdose that. So making sure that you're in a well-lit place and that you're paying attention to what you're doing with those medications.
Okay, now if a situation arises and maybe, you know, you have a child that has taken some medicine that's not theirs or gotten into a cleaning supply or something of that nature, what do you do? What is protocol?
Right. Well, this is something that's very common. A little over 1 million children a year have problems with ingestions of medications and poisons. So the first thing to do is to call the poison control number. That number is a standard number across the country. It's 1-800-222-1222. So that's basically the 911 of poison control. And so the science of poison control has really advanced to where they know what to do specifically with almost every type of household chemical and every medication. There are some things that can be treated at home with just observation. There are other things that would need to go to the emergency room right away. So the very first thing you need to do is to call that number, and then they'll direct you. They're very nice there. They will follow your child throughout the course of the ingestion. They call back to make sure that the child is doing well and that you followed those instructions. So it's a very, very good number to have.
That's pretty cool that they follow up on that too.
Yes.
So and I guess maybe they would help keep you calm too in that situation.
Right. I mean, it's a very stressful situation, especially for a young child. And sometimes that ingestion may not come to light right away. You may notice later that your child may be acting differently and then discover that they've taken medication. And so an approximate time period of the ingestion is important to know when the last time the child was acting normally. And so they can direct you according to what the child is doing and what you took.
Excellent, excellent. Thank you for joining us today.
Thank you for having me.
On our series. And we continue our series again, like we said. And maybe if we could show that number one more time, 1-800-222-1222 to call Poison Control if you have an issue. We'll post that on our website as well. You know where to go, WTVY.com for that and more information on For the Children.